IMSA Medical Group, in collaboration with the Institute of Medical Sciences Africa IMSA, recently concluded its highly anticipated IMSA Medical Week 2025 event, bringing together medical professionals and experts from around the world. The event, held over a week, featured a series of advanced medical procedures and workshops. One of the highlights of the event was a bariatric surgery performed by renowned surgeon Dr. Ayoola from the United States of America. The procedure demonstrated the latest techniques in weight loss surgery and drew significant interest from attendees.
Hi, this is Dr. Ayoola. Just wanted to let you know that we were done with the procedure. It was a complete success. This is our second sleeve at NISA. Our patient from yesterday is doing wonderfully well. He's up and about. In fact, he was greeting all the patients this morning to let them know how the procedure went for him yesterday. So we're done with our second procedure. Went very smoothly. The staff is learning more about how I approach the operation, so they're very prepared. The surgery went excellently. Everybody was very happy. Everything went very well. We are hoping that the post-operative course also goes well. We anticipate that. And we're very excited. We're excited to be bringing some new technology to NISA. We introduced a couple of new instruments and new techniques today. And so we're looking forward to this continuing. Dr. Anthony was there assisting me in the OR. He did a fantastic job. The support has been incredible. So I'm excited, and I'm glad we're able to do this here in Abuja and here in Nigeria. I'm looking forward to doing this a lot more. Looking forward to changing lives here in Nigeria and here in Abuja as well. So I thank you all for tuning in. We'll keep you updated. Hopefully, by God's grace, more great things to come. Thank you.
Additionally, Dr. Austin Ozemika successfully conducted GI endoscope procedures, showcasing the latest advancements in gastrointestinal diagnostics and treatment. The event provided a platform for medical professionals to share knowledge, exchange ideas, and enhance their skills.
Medical tourism has gotten to the point where even those of us in the United States are beginning to say that we have to do something about it. Some of us are beginning to come back. I agreed, not completely, but at least come quite often to spend time and practice in Nigeria. And I think that would also help medical tourism to be reversed such that people don't have to go out of this country to seek for common health care. Get a colonoscopy, you should be able to do that here. Common heart diseases should be able to be treated here. And that's why it's important that some of us in the diaspora take this initiative. Is it easy? It's not going to be easy, but this is the only country we have, and whatever we can do to reverse this medical tourism, we're willing to do that.
Thank you. With obesity, if you look at the information, the higher your BMI, which is a number that calculates your height and your weight to get your proportions, the higher your BMI goes, the shorter your lifespan. So what we're doing with what I do, weight loss reduction, is to make sure that your BMI comes down so you live longer and you have a better quality of life as well.
We know that medical intervention is key, and it just breaks our heart that we have so much to offer to people in the diaspora, and our own people are traveling to different places to get medical intervention for medical tourism. So the goal is that we're able to have Nigerians, instead of traveling abroad, we can actually bring them abroad. And when we're talking about abroad, it's bringing the highest quality that exists in the United States, in Canada, in the United Kingdom, Australia, in other places. And we'll try to make it as affordable as possible for them. You know, this is just it's just giving back to our own country.
IMSA Medical Week is an opportunity to bring the best hands that Nigeria has outside the country to come and work at home in a very nice setting to help the Nigerian patients who ordinarily would have wanted to go abroad. So we are trying to reverse the idea of people needing to go abroad and bringing home the very best level of medical care by Nigerians, combining those who are abroad with those who are at home. One of them is the level of expertise available in country. The second one is the state of the process of care, that is, the flow from the beginning of the illness to the end of the treatment. I know that the country is trying, no doubt about that, but systems abroad where our people are going, so-called medical tourism, have really advanced. And so the flaws of our own system is what is driving the people abroad. Lack of the correct quality of expertise, the total management space, and also the background. You have things like electricity stability and so on, which has been overcome in many other parts of the world. So I think the idea is to develop a system locally that allows those who are practicing abroad to come home and still practice seamlessly. Electricity is working. There's some security, there's quality of medical care and patient information. I think those are the issues. There's a whole big spectrum of things. Lifestyle, which can predispose to diabetes, which can predispose to hypertension, and many other diseases that can be stress related. These are the reasons. We are a developing region. So these things come. Our diet patterns are changing, the way we live our lives are changing, leaving us to be victims of things that were not necessarily so common in the days gone by. So we are paying a price of civilization. That's the best way to put it. Of course, there has to be genetic predisposition. The good news, though, is many of us are living long enough for those diseases to express themselves, unlike days past when our life expectancy was short. So we also must develop the response channels to say prevention is better than cure, so change in lifestyle, early detection and management, and also when they come to have the facilities to treat. Sometimes it enters into open heart surgery, sometimes it enters into kidney transplantation, and I'm pleased to say that Nigeria is rising even in those aspects, but we're not there yet. So people would like to go abroad for one or two things, but why not bring the experts from abroad to come home so they can even give care to a larger number of people than one or two individuals. It's a new phase of medical treatment here. It's not well understood how it can run seamlessly. One of the things that saves the situation abroad is that you don't have to, even living people will say, if anything happens to me and I die suddenly, take my kidney, take my heart, take my this, but take my cornea. We don't have that here yet. Yet we are caught in the rising wave. I'm very happy that this is highlighted by the gentlemen of the media like yourselves, and Nigerians are becoming aware. What are the alternatives to the wrong practices? Part of it is clear guidance of the law, and I'm pleased that the country has a medical standards committee headed by a very eminent Nigerian, and they've already produced a document that guides everyone in this practice. The law saves us, and I know the National Assembly is up to steam with what they're supposed to do. After that is the fact that a campaign must be mounted for those who are living to think of the day they will leave this world and what they can use, what part of them they can give so that life of others can continue. Once that is achieved, then all of the stories you are hearing will no more happen by the grace of God.
IMSA Medical Week 2025 underscored the importance of continuous medical education and collaboration in advancing healthcare standards. The event's success has set a precedent for future medical conferences, promising to drive innovation and improve patient care.
The hospital and have your colonoscopy done, you will be sedated. You will go home. You will not have a complication. You will not bleed to death. And these are things people are looking for. So, not to prolong this matter, I think it's important for us to know that we will continue planning. We want to be able to say at the end of the day that we can do it.
They just concluded IMSA Medical Week 2025, brought together world-class surgeons, renowned Nigerian medical experts, and emerging healthcare professionals for a week of intensive knowledge sharing, live surgeries, and impactful mentorship. We are proud to have performed 4 successful bariatric surgeries, and also completed a significant number of gastrointestinal procedures. And of course, we delivered hands-on training and knowledge sharing to build our local surgical capacity in country Nigeria. Preparations are currently ongoing for the 2nd edition of the IMSA Medical Week 2025, and this is going to happen in the 4th quarter of this year 2025, which will include more specialties and procedures, promising even more impact, innovation, and international collaborations. So don't be left out of what's to come. Be part of the 2nd edition. You can book your appointment today or visit our website on www.nisa.com.ng for more information. Together, we are transforming healthcare in Africa by reversing medical tourism, one surgery, one skill, and one step at a time. Thank you so much.